And hi, everyone. It's been a while. I haven't seen everyone in about 3 weeks for Talking Live with Macy. And this is our first Sunday back in November since the 31st of October. So, for those of you who are tuning in right now, as usual, we wait for 15 people to join us before we begin. It looks like it's slowly loading up, and we're slowly going to get people on the stream. So if you have friends, you have family, please share this with them right now to get them to join us on the stream. I know that it's taking a slightly longer these days when it comes to Facebook Live. So we have to wait for people to actually get notified on today's stream before they actually see it on the page. So once again, guys, if you're joining us today, this Sunday afternoon, please share this with your friends, with your family, because it's very important to be informed. We have two amazing experts here that we hope you can gain a lot of information from. I'm actually very certain you can. So please, ladies and gentlemen, for you tuning in, please share this with your friends, with your family. Hi, Tracy. Tracy, if you're tuning in, please share this with your relatives, with your people you know on your social media, so we can get more people to join us to be aware on today's very exciting topic on lung cancer. And this is Lung Cancer Awareness Month in the month of November. The numbers are jumping up. We need like four more people to join us before we begin so that we have people tuning in, people asking questions, because we have two experts. All right, the meter has jumped to 15, so I'm going to officially begin. A very good afternoon to all of you. I see everyone out and about. COVID-19 is still around, but so please stay safe. And I do hope that all of you are keeping healthy and safe. Thank you so much for joining us this afternoon to find out more about the journey towards lung cancer recovery and what you can expect. I know I haven't seen you guys in 3 weeks, and I'm glad to see you because it has been hard to get the two doctors at the same time. So, if you might not have already known, lung cancer is the leading cause of cancer death in the world. And despite this, very few people know about this disease, and they're actually not equipped with the knowledge to know on what they can expect upon diagnosis and what needs to be done. And therefore, I'm very pleased to have two of our experts here today who are very special. They are going to help us understand more about the lung cancer recovery journey. So we're going to welcome them now. They're here, as you can see. We have Dr. Yap Bing Kyok, consultant clinical oncologist, and Dr. Hilmi Lokman, consultant respiratory and internal medicine physician. So, hi, Dr. Yap and Dr. Hilmi. It's good to
Hello.
see both of you.
Hello.
Hello.
It's been a pleasure to be present today. Yes.
Yeah, it's such a privilege to get both of you at the same time on a Sunday afternoon. I know it's very difficult. So, I know a lot of you are joining us on a Sunday afternoon. So, if you have not joined this show before, how it works is that we hope to hear from you. So, start typing in your questions for both doctors so they will be able to pick them up at the end of the show and we don't have a backlog of questions. So, please start putting in your questions now. And also, during this time, you may share it with your friends and with your family today's Facebook Live session. So, Dr. Hilmi and Dr. Yap, thank you for coming on the show once again. We're going to jump straight to the questions for you. This is so that everyone will be able to make informed choices and important decisions with confidence. So it's time for us to dive straight into today's discussion. And like I said, please stick around, start asking your questions so you can find out more. And we have two very amazing experts to be able to answer the questions that you have. So, Dr. Hilmi, I'm going to ask the first question, which is for you. What are some of the recommended tests to determine if it's lung cancer?
Okay. Number one, of course, then there must be a suspicion that somebody has lung cancer or possibility there might be lung cancer. So we start off with the basics usually. So we would like to arrange for a blood test, among others, to look at things whether the organ is functioning quite well, looking at the kidney function, look at the liver function, there's any liver abnormalities. We can look at the blood count because some people do present with lethargy, feeling tired, so the blood count can be low, especially if the lung cancer has spread to things like the bone or the marrow. So that can cause some reduction in the blood count. Um, some people do also present with coughing out blood. Obviously, if there's a significant amount of blood loss, then that can show up on the blood test itself. We do occasionally do blood tests looking for cancer markers, but this probably not too specific at the current moment in time. And next important thing will be things like getting a chest X-ray. So when we talk about lungs, and obviously we talk about chest X-ray, it's very simple test to do. Um, so just get a rough image to see whether there's any significant abnormality there. But unfortunately, but the thing to be aware of is a chest X-ray itself is not is a crude way to have a look at the appearance of the lung. But obviously, if something um, can still be missed, so a CT scan will be the next best thing. If there's any suspicion of any possibility there might be underlying cancer, certainly I would suggest just get a CT scan straight away. It'll be better, and it has to be a contrast scan. So once you've done that, if there's any suspicion there'll be a cancer, then we'll be thinking about things like getting some samples done or investigations to obtain the tissue. So without obtaining the tissue, there's no way we can actually plan ahead and consider the types of treatment that might be available for the patient. We was also would like to know the extent of the disease. Once a cancer diagnosis is suspected with the CT scan or even with a biopsy, then one might be having a prospect of going through something called a PET scan or CT PET scan, which is a combination of a CT scan combined with a different imaging technique where we look at the molecular activity or metabolic activity of the tissue. That, for cancer, we know that the tissue itself will use a lot of energy. So in really what we're looking at is any tissue that's using a lot of sugar. So it will just light up. So it can be, if it's purely in the lung, it's good. So we look at other organs that might signify that the cancer might have spread to other organs. So that would change in terms of staging of the disease, which we'll talk about later on. Now, to know whether how well is the lung doing also is important to do something called the lung function test. Now, this is important, especially when we're thinking about whether there's any possibility a person might go for surgical resection or removal of the possible tumor. So you need to know whether somebody can cope with the loss of parts of the lung. So lung function is quite important. Now, again, with regards to after getting a biopsy done, sometimes what we do is we send specific markers for the test to know, number one, whether the tissue itself is coming from the lung, cancers come from the lung, and secondly, it will guide treatment, which I will think that Dr. Yap will be the best person to talk about that.
All right. Thanks a lot, Dr. Hilmi, for sharing in detail about the different diagnostic tests available for lung cancer patients. So, a follow up question for you then is, can you share with us the different stages of lung cancer? I think this is very important for many of us to know and be equipped with that knowledge and what differentiates each stage. So, I'm going to share your slide up so it's easier for you to explain to everyone here.
Sure, thank you very much. Okay, if you look at the screen that can you put it on the slideshow, please? It'll be a bit.
It's actually on a slideshow. Oh, you want me to
Okay.
put it?
Yes.
Okay, yeah.
Yeah.
So you want me to put it like that?
Yeah, they'll be a bit clearer.
All right.
So, okay, if
Okay.
you look at the stage, okay, first of all, lung cancer is from, I mean, we divided into 4 stages from stage 1 to stage 4. Now, stage 1, the tumor is quite localized, small, less than 4 centimeters, no spread to glands in the center of the chest or anywhere else. So, and this is the type of limited stage lung cancer that we will think that we can remove and hopefully achieve a complete cure. Okay, once we reach a stage 2 tumor, So the size will be somewhat bigger, between 3 to 7 centimeters. There might be some spread within the same part of the lung, and also there might be involvement in some of the lymph nodes or glands on the same side of the chest. Once it reaches a stage 3, then the tumor is still again 3 to 7 centimeters. Disease would be in more than one lymph node and can spread to the central parts of the lymph node, but not beyond that. Once we reach a stage 4, the spread has gone beyond the lung and spread to brain, liver, bone, elsewhere in the body. So I think at this stage, then certainly surgical resection is not possible. Then we'll be talking about more in terms of medical treatment.
So, Dr. Hilmi, basically, in terms of the staging, are you saying that this is just a question I had?
Sure.
For surgical resection, it's until stage 3 you can still surgically resize it.
Yeah, it's possible, but mainly we would concentrate more on the stage 1 and stage 2. Mm.
I see. Okay. So, thank you so much, Dr. Hilmi, for answering that. The next question is for Dr. Yap. What are the treatments options available in Malaysia? And also, I've heard that treatment options can be customized towards each patient. So, what are some of those safe factors for customization?
Okay, before I go into treatment, I'd like to take this opportunity to introduce to the audience what Lung Cancer Network Malaysia is. LCNM is a non-governmental organization that Dr. Hilmi and I belong to. I'm a council member. And the main goal of LCNM is actually to promote the awareness of lung cancer to the public in Malaysia, with the aim ultimately to improve the treatment outcome for Malaysians with lung cancer. So what Dr. Hilmi alluded earlier about the different diagnostic tests, and he briefly touched on the certain surgical treatment, and I'm going to go into more detail. I'm pleased to announce that LCNM and also National Cancer Society Malaysia has recently introduced the first ever patient guide for lung cancer in Malaysia, which I'm going to show you the book here, okay, and then we're going to give you how to download this guide, and it has a lot of information with regards to treatment, investigation, as well as the screening involved in the lung cancer. So we know that there is a lot of gaps in terms of information out there for patients and their families because of the lack of awareness. So we hope that this guide would give them more information in terms of making informed decisions about their treatment, and equip them with knowledge so that they can discuss with their healthcare provider, especially their specialists. So this guide is available in 3 languages, in English, Bahasa Malaysia, as well as in Mandarin. So this guide is quite comprehensive in providing the signs and symptoms of lung cancer, and it will take you through the screening using Lowdose CT scan, and also it talks about the staging that Dr. Hilmi alluded earlier, and it will also talk about the various modalities we use in the treatment of lung cancer, including surgery, radiotherapy, chemotherapy, molecular targeted therapy, and immunotherapy. So these are the main sort of modalities we have in terms of treating lung cancer. So I'll briefly go through each of them. Surgery, as you know, alluded by Dr. Hilmi, is a surgical resection, mainly for stage 1 and 2 and very early stage 3. And then for stage 4 patient, it becomes very complex. So apart from taking a sample from the cancer, we have to test for what we call molecular testing, or genetic changes inside the cancer cell. So nowadays we have many molecular testing because we have different drugs that target each of the what we call mutations that is present in that particular cancer cell. So the treatment is very different. We also use radiotherapy. Radiotherapy combined with chemotherapy, we sometimes use that for stage 3 cancer. But we also use radiotherapy, which is high energy X-ray. We focus that to the tumor and the sites, let's say lymph nodes, that has been affected by the cancer. And radiotherapy, we can also treat sites where the cancer has spread to, such as the brain, the liver, the lung, the bones, and so on. And for chemotherapy, these are usually drugs. It can be given intravenously or it can be given orally. They usually affect fast-growing cells. We know cancer cells are fast-growing cells. At the same time, it will affect cells which are fast-growing, such as the hair follicles and the mucosa in the mouth and the gut, so which can lead to some side effects such as hair loss, mouth ulcers, and diarrhea. Molecular targeted therapy, mainly it deals with, we know that there are certain changes in the genetic component of the cancer. And so these are specific drugs that target the receptor protein. Typically, the side effects involve skin rashes, fatigue, and some other side effects that the specialist will discuss with the patient. And immunotherapy, there are drug treatment also, which is used to treat nowadays in many types of lung cancers. What is immunotherapy? We know that in normal immune system in a healthy person, the immune system keep a surveillance of the immune system. And for some reason in cancer, there's a change in the cancer where the presence of the cancer cells are camouflaged, so that in the giving the immunotherapy that will unmask the presence, the immune system can recognize the presence of the cancer and attack the cancer cell. So this is how immunotherapy in a sort of layman's term.
All right. Thanks a lot, Dr. Yap, for sharing more on immunotherapy and basically all the different types of treatment. I think I also asked about the treatment options that can be customized towards each patient. What are some of the safe factors for that? Would you like to add on, or Dr. Hilmi, would you like to add on that?
I tell you for Dr. Yap because he tends to do mainly for the treatment.
So nowadays, as you know, I've mentioned we have many modalities of treatment. So it depends on, first of all, what we call patient factors and tumor factors. So patient factors, it depends on how fit they are, whether they have other what we call comorbidities, whether their lung function, as alluded by Dr. Hilmi, if they can lie down, if they cannot lie down, they can't have radiotherapy. If their kidney function is good, their heart function, their liver functions are good, then we can recommend certain treatments. So it's very much depend on how fit the patient is, and not just by the chronological age. So we assess patient by their fitness based on their what we call performance status. And then tumor factors, it depends on what type of cancer, what genetic change there is inside the cancer, and there are many other tests we do that and to individualize the patient's treatment. And also we have to take into account the patient's choice and preferences and their cultural and religious background. So nowadays we provide something called patient-centered care, where we have to respect each patient's decision and they share that information with the family and also patient themselves. So I think it's a very individualized based on these kind of factors.
All right. So, Dr. Yap, as we all know, when you talk about patient centered treatment, there's a lot of false information circulating online, be it on WhatsApp or just internet, which can be confusing. So, what is your advice for lung cancer patients out there who are unsure on what questions to ask upon their diagnosis?
I think that's very important to equip yourself with information, and how you get the information is important. So if you just type in Google, your lung cancer, you get thousands and thousands of hits. so it may not be relevant to the question or the you're looking what you're looking for. So I think my advice is that to go for reputable website. For example, the National Cancer Society, the LCNN website, and I've given you the patient guide, the ever digital patient guide in lung cancer. So I think it's important not just to look at a personal testimony. I think that is a bit dangerous based on one person's experience. So I think you have to sort of look through which organization which is providing the information. Not from a single person, a single person's experience, that it may not be accurate. So I think just be careful, and also if you have any doubts, always talk to your healthcare provider. They can guide you in terms of which is a website, where to get the information. I think you have to be very careful. Yes.
I totally agree with you. And that's why we have today's session, because both of you are the experts, and we should actually be getting information from both of you, healthcare providers and people who are knowledgeable about the said disease, which is lung cancer. So the next question then is for Dr. Yap. Once again, Dr. Hilmi, you can add on after. Dr. Yap, how would a patient know whether their treatment is working? I think this is something that a lot of lung cancer patients want to know.
Yes. So broadly, I categorize them into two ways. One is what we call a subjective ways, and the other one is more objective ways. So subjective way means if the pain is improving, their cough is their cough symptoms is improving. So let's say for a patient who's coughing up blood, if the treatment is working, they're coughing less blood, they're less tired, their appetite has improved, so their pain is better, the amount of painkillers they have to take is less. So this is a more subjective way of telling you the treatment is working. But in medicine, in oncology, we obviously like a more objective way in assessing the response to treatment. So that would involve scans, usually, like Dr. Hilmi alluded, CT scans, PET scan, MRI scan. So MRI scan is very good for the spine and for the brain, whereas PET scan is a good way in assessing how the disease in various sites affecting the body is doing. Also, we have cancer markers. Always remember, cancer markers is not that sensitive in screening for cancer, but it is useful for monitoring response if that particular cancer produces the marker that you can measure in the blood. So that will give you what we call a surrogate marker in terms of monitoring response.
All right. So thanks a lot, Dr. Yap, for answering that question in terms of the tests to be conducted to determine whether the treatment is working. So for those of you who are tuning in now, I'm sure all of you have a reason to do so. But what we're trying to do is raise awareness about lung cancer and to go for early detection, or rather early screening. So please share this with your relative, with your friends, with your family, so they're aware, they come in, tune in, and ask questions. I have two more questions for our experts. So for those of you who are tuning in now, continue to put in your questions so I don't have a backlog of questions that I cannot pick up at the end. All right. So the next question is about palliative care. We're talking about recovery, the lung cancer recovery journey. So I believe Dr. Hilmi, you can take this first, followed by Dr. Yap. When does palliative care come into the picture?
Okay, most people, when they hear about palliative care or palliation of treatment, is usually care for treating the symptoms that the patient experiences. Now, it doesn't mean that it's actually towards the end of the journey of being a cancer patient where there's nothing else that can be offered. But sometimes when we get the palliative care team, because they can manage the symptoms that the patient experience much better in some ways. So, and plus they can give additional support that the patient might need, social support or management of certain types of care, like involved with the OT, with medical equipment at home. So I think that's where palliative care is quite good in helping like for chest physician or even for oncologists, but also towards the end of the journey, if treatment is still ongoing, but the patients still seem to be deteriorating, then maybe to get palliative care involved, mainly just one is for introduction, rather than so that they actually know these people, they know the services that's involved. But sometimes what happens is people get introduced a bit too late. I think people, there's
Yeah.
too much anxiety, people are too anxious, people are too sad in hearing what's going to happen, things like that. But they can actually be a big help, especially from the emotional side, and the supportive side as well. I think that's it's quite important. For palliation, I mean, there's a lot of organization just give palliation support. That's also been introduced in the guidebook as well. The SNM guidebook for patient care, lung cancer is very informative, not only to the patients, but also to the doctors as well treating the patients. Sometimes they don't know, okay, where can I get palliative support for my patient? So who do I contact, whatever. I mean, the guidebook does have contact for where they can get in touch with somebody to support their patients.
All right. Thanks, Dr. Hilmi. And Dr. Yap, would you like to add on about palliative care?
Yes, I think palliative care is provided by many healthcare professionals. It is not just by palliative care physician.
Mm.
It is provided by respiratory physician like Dr. Hilmi, oncologists like myself, the nurses, palliative care nurses, the physiotherapists, and occupational health therapists, and so on. So many people can be involved in providing palliative care to patients. And palliative care can be provided in hospital or in the community. In hospital, where Dr. Hilmi and I, as physicians, we can provide that. If it depends on the hospital setting where whether they have a palliative care physician. If not, then the oncologist or respiratory physician will provide that. And in the community, we're very lucky. We have like Hospice Malaysia, who can provide the palliative care in the community, where the palliative care nurse can visit patients' home, and they can provide many services that people may or may not know about. The services they provide, such as they provide pain relief. They provide painkillers and advice on pain management. They can provide oxygen. They can provide hospital beds. Where it's easier to care for a patient at home. They can provide a wheelchair, commode, and so on. And also, they can teach you how to perform bed bath. Some patients cannot have a normal bath, so they can provide that kind of knowledge and how to do it. That kind of information is important for caregivers.
That is very true. And like both Dr. Hilmi and yourself mentioned, a lot of the organizations available are also in this guidebook. So, or you can download it at lungcancer.net.my. So please check that out. I think it's very good resource and valuable tool for everyone. So my final question before we take the questions from the audience is for both of you once again. This is a spotlight to the caregivers because it's not easy to caregive for especially late stage lung cancer patients. So expanding further on lung cancer management, could you tell us a little bit about the role of a caregiver and their significance in the lung cancer journey?
I think for the very start, in terms of giving the diagnosis to the patient, previously, I mean, people were just too concentrated on the particular patient themselves. But the thing is, the patient cannot go on to their own journey for cancer treatment without any good support. So this usually, we would encourage patients to have good family support, a caregiver, closest family members. Sometimes it doesn't have to be one single person. It can be um, closer family, like a wife, a child, but also can be very close friends as well. So I think there's something, the roles varies, but there's usually sometimes not just one single person. So, and then this single person, this people usually follow on to the journey the patient goes through for the treatment, help them in terms of coping with coming to the hospitals, transport, supporting their meal times, etc. And to thick and thin, usually the same person has to go through the journey, and it's hard for the patient. Sometimes it's even hard for the caregiver, and people normally forget about what the caregiver have to go through. I think people, as doctors as well, we should, if we haven't, be asking them, so how are you coping? How's things at home? How's the family? I mean, it's good to know all these things. I mean, because we are human, they are human as well. So they've got a lot of emotional um, experiences that they also need some support as well. I mean, not just for the patient. And you can try to obtain some help for them, certainly from the psychological side, and it will help them a lot. Mm.
I totally agree. Caregivers play such a huge role. My mom is watching today, I think. So
Mm.
thanks, mom. You're an amazing caregiver, and also my current husband, who was my then boyfriend. So
Mm.
I give props to the caregivers because they go through the journey, sometimes even more emotional than the patient
Mm.
themselves. Dr. Yap, would you like to add on?
Yes, I think, we often forget about caregivers and the role they play. And caregivers sometimes are put in that position in a very sudden circumstances where their loved one from an independent person becomes their dependent. So, they need a lot of help in terms of, Dr. Hilmi alluded transport to hospital for their treatment investigation scans, and then their daily tasks like banking, insurance claims, and so on. And the caregivers, it is important. They are there to help the patients. And my kind of experience in dealing with caregivers are that, often patients themselves sometimes they refuse treatment because they felt that they are a burden to the caregivers, because they have to the caregivers has to take them to hospital, and they worry about they are leaving their own family behind, and then they have to take time off work, and these are very important issues in terms of making sure patients can come to hospital for their treatment. So the caregivers should be given a voice, I feel, to voice their concern. And as Dr. Hilmi mentioned about, patients who is undergoing cancer treatment, they can lose their appetite. And caregivers sometimes they feel that, they spend a lot of effort in preparing a meal for that patient, but then at the end the patient don't have the appetite to eat the food. And then it's something that they have to understand. It's not they don't want to eat the food that has been prepared for them. Sometimes it's just they don't have the appetite and the treatment related side effects. And I think, for caregivers it's so important maybe to share the burden, for let's say if you have several family members in the household. You can, siblings, they can help and take turns to take the patient to hospital. It's always nice to have somebody accompanying you, but nowadays, you can work from home, and a lot of my patients, caregivers, they actually continue to work while their patients having chemotherapy. Have internet access. They use their laptops. They have Zoom meeting, and so on. So I think, it's not necessarily that they would lose income because of spending time and take patients to hospital.
Yes, I wholeheartedly agree. Thanks a lot, Dr. Yap and Dr. Hilmi, for actually wanting to spotlight caregivers in the lung cancer recovery journey and for generally cancer patients out there. Thank you so much to both of you. It was very insightful, and I'm glad you both of you wanted to bring it up, both palliative care and the caregiver journey as well. So now we're going to open the floor to questions. So if you have questions, it's a good time to put them in now. I'll try to take as many questions as possible because both doctors are very busy. It's a Sunday afternoon, their only break day. So I'm going to go through the questions for both doctors. So the first question is from Madeline. She asks, "Hi doctors, what are the little known symptoms to look out for?"
Okay, if you don't mind, I'll take this one,
All
Dr. Yap.
right.
Okay, now the thing about cancers is that for lung, it tends to present quite late. Okay, because if you can appreciate, I mean, lung tissue is quite big. So whenever it starts to cause it, start to impinge the airway, start to cause a bit of bleeding, um, start to I mean, cause the lung to produce more fluid, for example. So that's when people do start to develop problems or symptoms, and unfortunately, these tend to be quite advanced. Um, so for people to get diagnosed at a very early stage, stage one or even stage two, in most cases is just pure luck. I mean, my experience. Okay, they just go for medical checkups, or they found something, or decide to get a CT, or there's something there. Um, uh, but what we tend to advise our patients is that if any symptoms, especially respiratory symptoms, prolonged cough, fever, coughing out blood, I mean those are quite urgent. Cough anything more than 2 weeks, do seek some help. If you have seen a doctor with treatment is not going away, I mean do ask for an X-ray at the very least. Okay, it's not perfect, it's not as good as a CT scan, but for people who I mean at the very start, I mean it's good imaging test. But for people who are having other symptoms like say losing weight, smokers with prolonged symptoms, you probably do need to see a specialist and maybe get a CT scan. I mean that's probably one of the best test modality that you can get. But yes, I mean predominantly will be respiratory symptoms, feeling lethargic. Weight loss is frequently forgotten, and also some people think, oh, I'm just changing my diet, so I'm losing a bit of weight. But losing weight more than is expected is something that's very important to look at, and having no appetite is another as well. So I think those probably are the main ones.
Yeah, I agree. I see a lot of questions coming in, so I'm gonna take on the second question now. Thank you, Dr. Hilmi. Like when asked, do younger people need to look out for lung cancer too, especially those in their 20s?
Okay, I've seen a few patients in the 20s and 30s starting to develop lung cancer, the same as with my other respiratory colleagues as well. So we are seeing this in the younger age group. Um, One, it may be partly genetic, but I think others could be people who smoking earlier in their lives, and also people who has history of I mean, poor diet. I mean, nowadays, I mean, whatever we take, it tends to be processed food. I mean, it's not as what we used to have. People taking a lot of vegetables, fresh foods, freshly cooked. Processed food is one factor. Yeah, I don't think it's just purely for lung cancer. It's the same cancer in other types of cancer as well. So I mean, that's one thing that we do suggest. But people in their 20s, there are cases, but trying to screen them is very difficult. People who have very strong family history, certainly I would recommend getting them screened. Don't even start smoking. I think you don't gamble with your life really. I mean, some people think, oh, I'm young, I can afford to smoke for about 5, 10 years, follow my friends. But I mean, I don't think it's just worth it. You can never know how life is going to turn out in a couple of years' time. So I think do the best, live healthily, exercise. I mean, that's a good thing. But once a person is over the age of 40, usually, especially with those with strong family history, heavy smoking history, then do go for checkups. We would recommend getting a Lowdose CT scan. Radiation is very, very low. They don't get any dye
Yeah,
injection, and recommendation is once a year. So I mean, certainly, I mean that's one way you can go for. See,
yeah.
a chest X-ray is just not good enough for screening. Mm.
Yeah, I've heard of Lowdose CT scan, and I would encourage it for early screening for people
Mm.
with family history and heavy smokers, like Dr. Hilmi mentioned. So the next question is Audrey. She asks, for Dr. Yap, I'll put this question to you. How do we catch it at stage one or two if symptoms only present itself at later stages?
I think that's very difficult.
Mm.
Stage one and two, usually, in my experience, is that the patient came in for other symptoms, and then incidentally they were found to have early stage cancer. So I think that is why if you have unexplained symptoms, like alluded by Dr. Hilmi, you should seek medical help. I think generally, I think if it belongs to the high risk group. I think the smokers, as you mentioned previously, I think the low dose CT screening scan is important to detect early cancer.
Even secondary smoker, like secondary smoke
Yes,
also, right?
yes, yes, yes.
All right. Okay. So if you have a partner or someone who smokes around you a lot, it would be good to actually go for low dose CT screening. Highly
Yeah.
advisable. The next question is, hi, Dr. Yap. Nicholas asks, have you ever seen a stage 4 patient extend their life or recover with decent quality of life? I think that's a great question, actually.
The answer is yes. I think I've been in oncology for more than 20 years. So I think over the last I would say last 10 years, the treatment landscape for lung cancer has changed tremendously. You know, Previously when I was in training, we're talking about survival of less than a year for stage 4 lung cancer, and I have not one, I have a few, quite a number of patients now. Some of them has lived beyond 5 years, which has I have never seen many years ago. So I think of course it doesn't happen to all patients. It depends on their response to their treatment, and they have timely treatment, and they have to respond to treatment what is best for them. So I think the answer to that question is yes. I have seen patients surviving more than what I have expected. So I think the treatment for lung cancer is advancing, and every day we hear of new molecules being tested, and then they may come on the market in due course once it pass all the clinical trials.
All right. Thanks for giving us encouragement, Dr. Yap, to Nicholas, and I think to a lot of people tuning in today. There is hope. So the next question is from William. He's from Indonesia. He knows someone who was actually had a medical checkup and found out was then diagnosed with stage 3 lung cancer, but had no symptoms. So he asked whether this is actually normal. I think you both of you did mention that this is actually normal to not have symptoms, right? Until later stages at stage 3 and 4. Okay.
Yeah, that's right.
Okay, so William, we hope that answered your question. For lung cancer, unfortunately, stage 1 and 2 is very rare to be presented with symptoms. Um, and Ms. Xiao asks, does lung cancer affect the brains? I think this is probably related to stage 4, right?
Yes, it does. You typically during this what we call staging investigation, once you are diagnosed with lung cancer, especially if you're going for a surgical resection, which is what we call a radical or curative intent treatment, then it's important to make sure that the brain is not affected by the cancer. But even in any stage 4 patient, we routinely advise what we call MRI scan of the brain, because the treatment is different if you have what called brain metastasis or brain secondaries, because some of the drugs that we have do not penetrate the brain very well. So it has to be treated with radiotherapy. And nowadays we have very high-tech radiotherapy called stereotactic radiotherapy, and that can treat small volume lung cancer affecting the brain very well, and we can achieve very long-term control of the cancer.
Okay, that's good to hear. Thank you, Dr. Yap. And Tila asks, what kind of resources might be helpful to cope with the lung cancer journey? Anyone? Dr. Hilmi or Dr. Yap?
Well, one thing would be the LCNM patient guide. Okay, it's a good source. Again, the source will just give you some idea in terms of where can get information, what to expect, what kind of treatment that can be offered. But everything is going to be tailored to that particular patient. So every patient would experience something slightly different. It'll be tailor made to what is the needs of that patient. Experiences will be slightly different as well. But yes, LCNM will be a good source. Reputable medical websites, but you do need to try and be um, savvy when you're going through the internet, because there's too many things. There's not information not can't be regulated. It's virtually impossible to do so. Things Websites like the WHO, for example, so would give some idea or some information that you can get as well for information for lung cancer.
All right, thanks, Dr. Hilmi. I'll take maybe 3 to 4 questions before we wrap up. Sylvia asks, is there a support group for caregivers in Malaysia? And if yes, where can we find them? I know this. Sylvia actually can just ask me directly. The National Cancer Society of Malaysia actually has a support group for caregivers. I'll pass you the contact after this. The caregiver support group is growing bigger, and it actually helps with the caregiver journey. Helps them find out more information they can share with one another emotionally, and also resources such as information. So, Dr. Hilmi and Dr. Yap, do you have further caregiver information you would like to provide caregiver support?
I think you mentioned. I'm glad you mentioned about support group. I think support group means that either the caregivers or survivors of lung cancer, they are members of the support group, and then they can provide invaluable advice.
Yes.
Advice that is not just from the doctors. Tips.
Yes.
How to overcome your emotional stress. How you For example, how do you tell your children about your diagnosis? How do you tell your parents about your diagnosis? I think how to discuss about sexuality and a lot of issues. So I think they are invaluable. So I think support group is so important, and I hope that the caregivers out there can join a support group so that they can help others.
Yes, I totally
Mhm.
agree. So, Sylvia, I'll pass you the information. And Yen asks, is it recommended to have a certified caregiver to nurse the patient during treatment phase, be it targeted therapy, etc., apart from family involvement?
Dr. Yap.
I'm not. I mean, a certified a cert
Caregiver,
caregivers. I don't think you
like
need a qual.
nurses.
Yeah, I think you can, but I think you don't need a
Mm.
certification for caregivers. I think everyone has their own skill. They have their experience of life is different, so they have different skill, counseling skill, listening skills. So I think multitasking is important. So I think you don't need a certification for that. I don't think you need that.
I think the
Okay,
key thing is what you're trying to, if there are
ask.
any specific concerns. So normally the family can ask while the patient's in hospital. So what should I be looking for? So things that mainly I suppose would be things like side effects, complications will be quite useful. So when to seek help, when should I go back to the hospital? So things like that. So all the other stuff, most of the time. I mean, the cancer nurse usually can provide some form of information, giving the information, especially things like oxygen. So if the oxygen runs out, where do you go for? I mean, it's a lot of it tends to be information, and this is something that I think
Yeah.
the caregiver group, support group, would be uh, beneficial for to get this kind of information.
Yeah, so in terms of more medically related caregiving,
Yeah,
maybe it would be good to ask like the healthcare professionals that
yeah.
you are actually
Mm,
consulting with, and also to join a caregiver support group. I think
mm,
that's very important.
mhm.
Um, I think the last question I'll take for this afternoon is from Yen Li. She asked, for stage 4 lung cancer, patient condition is usually stable, can eat well, and sleep well, exercise, and do their normal daily routine. So, as a caregiver, what symptoms should they look for in the patient in the event that the condition deteriorates?
I think, if you talk about the symptoms related to the cancer progression, let's say, it's stable and then you think it may progress, I think the list will be endless, and I don't think it's wise to just go through the list. But I think what I would say to them is that, if anything out of the unusual, you think that, they're becoming more tired, they have pain,
Mm.
which is
Mm.
not related to anything that is making it worse, they have cough, or they start losing weight, and they are not normal person, normal, they feel the symptoms is get progressive. What I would say, any symptoms which is progressive, then you may want to discuss with your healthcare provider. Any symptoms where it comes and goes away completely, maybe it's
Yeah.
not so relevant. So I think that's what I would say.
All right. Thanks, Dr. Yap and Dr. Hilmi, for actually answering all of the questions posed. I'm so sorry for those of you who I couldn't take your question because there are too many and time is running out. So, with that said, we've come to the end of our live session for this afternoon. For those of you who have stayed with us, thank you so much for joining us for this very valuable discussion. We hope that you've benefited a lot from it. And for those caregivers out there or even patients, remember that you're not alone on this journey. There are so many treatment options and resources to navigate your lung cancer journey. And once again, thank you so much, Dr. Yap and Dr. Hilmi, for spending time with us and sharing your knowledge. I'm sure all of us have gained so much from this afternoon. And with that said, we're happy to share again that Lung Cancer Network Malaysia, LCNM, and also NCSM, National Cancer Society of Malaysia, supported by Pfizer. They have recently put together an up-to-date, comprehensive, yet accessible digital guide for patients and their loved ones in hopes of closing the awareness gap we see here in Malaysia. Like I mentioned, this is the guide in the physical copy, but we have it online for you to download. So this is catered to everyone, all members of the public. So it is layman, it's very friendly to read, understand. I've seen it. The diagrams are amazing. It's available in three languages: Malay, English, and Mandarin. And we would like to ask you to download it because a few of you have actually asked questions. How do you download it? The next question is download it at www.lungcancer.net.my. It's already on in the comment section. So you just click on the link and download it. There's a link available in the caption right now, actually. So thank you once again for making yourself available for today's session. To find out more about lung cancer and for Lung Cancer Awareness Month. And I look forward to seeing all of you again. The next 3 weeks, which is starting next week, we're going to talk about psoriasis. So please join us for those sessions to find out more. And thank you for your questions. Really appreciate it. Thank you, Dr. Hilmi and Dr. Yap. Have a great day ahead, everyone. Thank you. Bye.
Bye
Okay,
bye.
bye bye.
Bye
Take
bye.
care.
Bye bye.
Bye.